Doctor's take on aesthetics. We're going to talk about jawline filler first. It is a growing trend.
You know, a lot of people are looking for that nice, sharp angle of the jawline.
Welcome to the latest episode of the Doctor's Take on Aesthetics. Today we're going to be talking all things jawline. We're going to talk about jawline fillers, way to do anti-wrinkle on the jawline, thread lifting, anything to do with the jawline itself. I am joined here today by my left-hand man, Dr. Fane, cosmetic physician extraordinaire. Welcome.
Thanks, Dr. Josh. It's a pleasure to be here. Thank you.
Awesome. So we're going to talk about a couple of different points. We're going to talk about jawline filler first. It is a growing trend. We're seeing many patients come into our clinic and ask for it. What is jawline filler? Can you let us know?
So, Dr. Josh, with jawline filler, we're all about augmenting the lower face.
Yes.
I think, you know, a lot of people are looking for that nice, sharp angle of the jawline. If we're looking at masculinizing, men are looking at just a bit of a wider jaw as well. And everyone loves chin augmentation. I think for men, we can make it wider. We can make it more square and more chiseled.
Yes.
For women, we can make a nice sort of point and quite a well-defined, softer line as well.
You've touched on an interesting point there about making a difference between male and female aesthetics. Very important when you're looking at a face, deciding on what actual look does someone want to go for. Do they want to masculinize? Do they want to feminize? Talk more specifically about how you'd masculinize the jaw. What kind of things would you do there?
Yeah, sure. So I think when it comes to men, we're looking at that nice sharp jaw angle. I often find that in men, a nice 90-degree angle really helps to provide that chiseled, contoured look. I think, you know, when we're looking at sort of the underside or the shorter area of the face as well, we're just looking at making sure that we can increase that width. We can really provide that nice contour for men. And then always with the chin as well, you know, we can put a few points through the chin. We can just look at squaring it up, often with the edges of the lips, and that just provides, once again, that nice, sharp, chiseled look.
Nice, yeah. I think that's a good point. So male, 90 degrees to the back of the jawline.
Yep.
Different to females. I like to do about a 120-degree angle for
That's
a
right.
female. I think it's far more feminine. Males, we're trying to widen the jaw. So the jaw, we call that the bigonial angle. So that's the bigonial width. That's the width of the two angles of the jawline separated. And in a man, we want to have it about in line with the cheekbones to have a real kind of similar to, not so much yours, more mine, but that real masculine look to the lower part of the face. And for females, we want to slim that in. How would we slim that in for a female, like
That's
the back
right.
of the jawline?
Yep. So I think if we're looking at improving the back of the jawline, sometimes just placing a little bit of filler almost through the underside of that face, that really helps to improve the sharpness. We don't really look at doing too much filler through the upper part. You know, we're just looking at a wider angle, as you said. I think 120 degrees, nice soft contour. And
in terms of slimming the lower part of the face, we do a bit of Botox or botulinum toxin to the back part. How would that work?
That's right. So it comes down to facial slimming, as you said. So with masseter injections, I find that especially
what's
if you...
a masseter?
So a masseter is this big, strong muscle at the back of our jaw that helps us to chew. I find that sometimes if you notice you're getting headaches or say you're grinding your teeth, it's also a great treatment for that. It helps to soften and relax that muscle. And certainly in women with repeated applications, you can look at that really soft contour and that widening of that angle that we talked about.
Say, for instance, if you go to the gym a lot, get massive biceps.
That's definitely you, not me, but yeah.
If I was to say if it is for me, say I was to stop training completely, don't use those muscles at all, in 6 weeks, I'm going to be back to baseline. So that muscle is going to no longer work as hard as it used to. There's no need for it to stay as big as it was. Similar to if you've ever seen someone who breaks their arm, they put it in a cast. When they take that cast off, their arm's really skinny. It's because they haven't used it for 6 weeks. So the masseter slimming works on the same principle. So you relax those muscles with an anti-wrinkle injection, so a botulinum toxin, and it's not working as hard, so it slims.
That's right.
You very rightly pointed out the treatment for teeth grinding, very effective, can save you thousands at the dentist.
Yep.
So some people use that for that reason itself. Now, we talked about, masculinizing the jawline, making a jawline or potentially a chin that's a little bit weak and back a little bit stronger. And this can be for men and women. But tell me about a recessed chin, so a chin that sits back, how that affects your facial aesthetic.
Yeah, so we often look at the side profile, Dr. Josh, as you said. I find that with the side profile, we use something called the Ricketts line. That's a pleasing, defining shape between the tip of the nose, comes through to the lips, and then ends at the chin. As you said rightly, so with a recessed chin or a chin that's a little bit further back, I find that that profile can often have a little bit of augmentation to look nicer and to look smoother. And I find that if we just help to improve that chin, we help to bring it out a little bit with some filler injections, we can really make that side profile look as best as it can be.
I think just adding to that as well, sometimes when people have under chin fullness itself, that can be due to just having not much of a chin. So if you pull your chin out slightly further, you make more of a horizontal line under the chin, and you can often, in some cases, solve that under chin fullness. So a couple of different benefits there. Tell me about someone who's older, say someone comes in their 50s and 60s, and they're having a bit of a sagging skin, they're starting to develop jowls, and they're hell-bent against surgery. For whatever reason, they don't want a facelift, which is the gold standard to treat that. What are some things you would think about there in terms of filler? How could you help them?
So as you rightly said, often when we're thinking about the lower half of the jawline, some of our patients don't quite know that if you look at the whole picture, you can really look at improving everything together. An area that we always like to focus on as well is the mid-face. I certainly find that, as you said rightly, in some of our aging patients, you think about hollowing underneath the eyes, you think about some of the loss of those important fat pads that help to keep those structures working well. I think a little bit of filler through those regions, say through the cheek, say through the under eye, that can help to prop and lift up the skin, give it that little bit of extra support. And then I often find that when we focus on the lower jaw, you can really get that nice, sharp, angled jawline. So it's a combination of different treatments.
So you're replacing lost fat, essentially. So, and I think that's a good point to talk about. That what often we do in aesthetic or anti-aging medicine is we treat some of the reasons you get aging. So in medicine, we call it the pathophysiology of aging. So the reasons why you might get it, and one of those is a loss of fat, is one of the main reasons why your face ages. Another thing is loss of elasticity. So targeting that loss of fat in the jawline itself, you can get the jowls forming, so the heaviness. If you don't want to undergo a lifting procedure, sometimes we can camouflage those areas. So we can put a little bit of filler in front, a little bit of filler behind to create that sharp jawline. Now, the hallmark of a youthful jawline is a straight jawline. So creating that nice aesthetic straightness to the jawline can be very, very helpful. One thing my patients come in, and it's a very difficult thing to treat sometimes, is they all complain of facial asymmetry.
Yeah.
And it's, what's your approach to facial asymmetry? Do we have any, I know we've got a bit of technology at Contour Clinics in terms of how we would assess for that.
Of course, yeah. So exactly. So there's this great 3D technology that we use here called the Vectra system. I find that with the Vectra, it helps to give us a few different points on the face. We're able to produce this awesome 3D reconstruction. And with that reconstruction, we can also show you, very, very slight asymmetries in your face. We can look at making sure that one side looks more closely aligned with the other side. And I find that's just a great piece of technology to show people beforehand and to also show afterwards as well. You know that your results are going to be apparent. You can see them on the screen. I think it's a great additional benefit that we can show here.
Definitely, yeah. It's a very difficult thing to treat, and I find when treating things like asymmetry, it's good to be as objective as possible.
That's right, absolutely.
Patients will come in and they'll say, and look, we both look at faces for a living.
Of course.
And they'll come in and they'll say, look, it looks this way, and I just can't see it. I can't see it, and that's why putting a 3D camera there makes it very objective. You can see the symmetry one side versus the other. And sometimes about managing that expectation, and we're not going to be able to get it completely perfect. Often some people sleep on one side of their face more than others.
That's right, Josh, yeah.
Over a long time, that can make you slightly asymmetrical. So I've never seen a symmetrical face, never.
It's impossible. We can get as close as humanly possible, but there's always going to be a tiny amount there, you're right.
Tell me about what filler do we use? How long does it last? What are you using?
Yeah, absolutely. So look, something with a strong, we use some fancy terms called like a G prime. Look, these are all terms that basically mean it's a very structural, strong filler.
Yeah.
There's some types of filler that are a little bit softer. You might see them put in the lips. You might see them in other areas of the face that don't need that structural support, as you're saying.
Yeah.
But I find, look, when we're looking at sharpening that jawline, when we're looking at creating that straight jawline, as you said, you want to use a filler that feels nice and rigid, and that rigidity is going to help prop up those underlying support structures in the skin.
You want to use a filler with, quite rightly pointed out, the high G prime. So G prime is a measure of how cross-linked a filler is. So if you think of, fillers made of the one we use is made of hyaluronic acid.
That's right.
And one of the properties of this hyaluronic acid filler is that it's cross-linked. So the molecules are bonded together, and the more bonded together they are, the thicker they are, the more able they are to withstand shear forces and to maintain their structure. So somewhere like a jaw, somewhere like a nose, you want it to mimic bone. So these fillers are thick enough to mimic bone, but also to create a very natural,
that's right,
aesthetically pleasing look and feel to the filler itself. Are there any other types of fillers we use? So hyaluronic acid is the one you were speaking about. Hyaluronic acid is the filler that's predominantly used worldwide. It is a reversible, it's a natural gel. We have it present in our skin, in the fluid in our eyes, in our joints. It is a natural product. What are some other things we might use?
So there are some other types. So you might have heard of calcium hydroxypeptide.
Yes.
So with calcium hydroxypeptide, it's once again quite a strong structural filler.
Yeah.
We need to make sure that when we're using it in those places that, you always want a safe practitioner that can put it in the right plane, in the right angle. We're avoiding all of those important vessels and structures.
Yes.
And so that's one of the good fillers as well for more of that stronger support.
Yeah, so that's more of what we call like a semi-permanent filler.
That's right, yeah.
So the semi-permanent fillers, the problem with them, they're non-reversible.
That's right,
So you need to get them exactly where you want.
That's right.
The nice thing about hyaluronic acid filler, it is predictable, it is reversible. So if there is an issue, we can reverse it. Now, things, sometimes complications, they're all a numbers game. So they'll happen to every practitioner. We'd like to think our numbers are very low.
That's right, yeah.
Compared to or relative to the industry, but it can happen to us, so we need to have a filler that is reversible, that is safer. The calcium hydroxyapatite is a very nice filler. The other thing, it relies on collagen stimulation.
Yeah, that's right.
So not everyone's collagen stimulation is the same. It's interesting, a lot of my patients will come to me and say, I don't like that hyaluronic acid only lasts for 12, 18 months. I want something more permanent. I always advise against that. The reason is that permanent fillers are, by their very nature, permanent. So if you do put it in the wrong place, if there is a complication, or if facial structures age over time.
That's exactly right, yeah.
It can tend to look a little bit ordinary as we get further down the track. The other thing as well is they tend to create an autoimmune reaction. So it is a foreign body. Your body will tend to wall it off somewhat. It can create what's called a granulomatous reaction. So it's where immune cells will wall off any foreign body. It can cause swelling, it can cause pain. And for those reasons, we don't tend to use it. They've actually got so the one that you typically hear of used is PMMA, and it's actually got quite an interesting story as to how it first developed. So it was developed in the Second World War, and a very clever eye surgeon was noticing that these fighter pilots, they would be flying and they'd get bullets or something into their windshield, and some would get some glass in their eye. Now, the windshields that were made of one product was causing infections, and the windshields made of PMMA didn't cause infections.
There you go.
So they realised they could use that as a implant in the body.
Very interesting.
And ever since then, they've been using PMMA. But whilst it didn't cause any infections, it can cause some issues long term, and it's for that reason we don't tend to use it.
Is that the granulomas that you were talking, which is sometimes those lumps and bumps that can appear and don't necessarily go away?
Yeah, look, I mean, that is kind of when it goes further, that is the end product of a delayed onset hypersensitivity is what usually is the initial insulting factor. But your immune system just doesn't like having a foreign body there. Yeah. So eventually it will reject it. The other thing as well, that's a problem that happens over the long term. Over the short term, I mean, if you get one of these things into a blood vessel, there's no way of fixing that.
Yeah, that's right.
So if you put hyaluronic acid into a blood vessel, which is a rare complication, if you're using needle, it's about 1 in 50,000. Yeah. If that happens, you can reverse that with an enzyme called hyalase. So it is a safer way to do the treatment. So when I'm injecting, I really like using that product because I have another safety net.
Yeah, absolutely.
To work on. I understand that we've had some patient questions that have been sent in. So our first patient question is, I'm a guy in my mid-30s and I've always been self-conscious about my weak jawline. I've heard that jawline fillers can help, but I don't want to look overly feminine. How can I make sure that my jawline looks defined and masculine after the treatment? Now, that is a great question, and it's something that I think a lot of guys out there are thinking about, because there is a bit of a taboo, especially for guys. I know our friends are still a little bit cautious about getting fillers, and some definitely should.
Of course, I think we're all getting to that stage, aren't we?
Some of them need it badly. I mean, most people don't need anything, but our mates definitely do. And they worry about, because they think this is a female treatment. I had a patient the other day. I started talking about this stuff, and he said, "Nah, this is for girls."
Yeah.
And look, we have very specific ways of treating men and treating females, or people that want to look masculine or people that want to look feminine.
Of course.
And we can make a guy look much more masculine. The ways we might do that are, we can square off a chin. Mm-hmm. So like you very rightly pointed out earlier, is that the male chin should be roughly in line with the corners of the mouth.
Yes.
Now, that is like the ideal textbook masculinity. If you look at Brad Pitt's chin, it's actually a little bit shorter.
Yep.
So there are some variations in that in terms of, attractiveness and male attractiveness. The jawline should be about 90 degrees. It should be sharp. It should roughly sit in line with the cheeks. So they're goals of the treatment. You want a very sharp, straight jawline as well for males. So you can take this one, Fane.
Yeah,
so
sure.
I'm interested in getting jawline filler, but I'm worried about the recovery process. How long will it take for the swelling and bruising to go down? Will I need to take time off work to recover?
So the way that we do the procedure, we make sure that there's lots of anesthetic and numbing cream on board so you're nice and comfortable. The goal is to minimize pain while we're doing the treatment. It's often just a few small injection points, and then we use something called a cannula. It's basically a blunt. It's a blunt tool that we use that goes into the face. It can't pierce through any important blood vessels. It can't pierce through any of those important structures, so you know that it's okay. Once we do the treatment, sometimes, as with all dermal filler treatments, there's sometimes a little bit of swelling and bruising that can occur. I find that a little bit of gentle massage, sometimes with an antiseptic cream as well, say for 1 minute, 2 to 3 times a day, doing that for a couple of days is going to help with reducing all of that swelling. That swelling will calm down after a couple of days. Any bruising as well will settle max after 1 to 2 weeks.
Cool. Next question. I've heard that dermal fillers can be dangerous if they're not administered properly. How can I make sure that a practitioner I choose is experienced and qualified to perform jawline filler treatment safely? Now, this is an awesome question. It's very topical at the moment.
Yeah.
And what I will say about this is that our industry, unfortunately, is largely unregulated. So it's clinics like ours that have to self-regulate, and the way we do that is we provide 10 to 15 hours of live education a week. All of our practitioners, none of us do it part-time. We're all full-time. This is our career.
Committed to the role.
We are completely committed to doing injectables, and I feel like a full-time practitioner, if you've done it for years, it is your profession. You're much more likely to do a good job. We all go to all the conferences. We do all the education. So look, it is very hard to choose. I would just say you go to a reputable clinic that has reputable practitioners that have been doing these treatments for a very long time. Also, they need to have, it's my opinion, they do need to have a doctor involved in the clinic.
Absolutely, yeah.
And not a doctor that just Skypes in from an external provider.
That's right.
They need to have someone who's on site, on premises, to manage any unexpected complications. And they do happen. They are very, very rare. Yeah. So there is... and you also have to watch out for a lot of fear mongering out there as well. There are a lot of practitioners that will prey on the anxieties of customers, and they'll say how dangerous this is. Look, complications from these things, that whilst they happen, they're very rare. Mm-hmm. So to give you an idea, injecting into a blood vessel is about 1 in 50,000. So it's very, very uncommon. But if you see enough people, especially if you're going to people that have discounts and sales, and they work on high volume, low margin business models,
of course,
they're ones that would, these are numbers games, and they often are paying cheaper staff that are less experienced. So it is a numbers game, plus there is an element of experience there. So I would just suggest when you go to a budget chain and you pay a low price, you get what you paid for.
Yeah.
You know, so ask yourself, if you are going for filler that is half the price of the usual market, ask yourself, why is it half the price? Because the person doing it's getting paid half the money as well. So, and there will be a reason for that. There's always a reason for that. So that's basically all I'll say on that. Do you have any final remarks to make before we kind of wrap this show up?
Yeah, look, I think, as you rightly said, Josh, do your research. That's really, really important. If you can, go to a clinic where they offer consults. You know, we have a complimentary consult. I think, you know, you get to see the clinic in action. You get to meet your practitioner. You get to feel comfortable with them. You can discuss your treatment goals together. Those things are really important in making sure that your journey and their ideals and what they hope for are aligned. You know, at the end of the day, we want you to be happy with how you look. We want to help enhance those natural features of yours. So I think doing all of those things, making sure that that first initial consult is taken care of, that's really important. Yeah.
Perfect. Yeah, very, very, very good. And look, we're going to wrap this up here with a little note from our sponsor, Contour Clinics. Now, each and every episode is sponsored by Contour Clinics. Contour Clinics are Australia's leading cosmetic injectable clinic. They have anti-wrinkle injections, dermal fillers, thread lifting, all forms of laser, plastic surgery, hair transplants, and dermatology. This is your one-stop go-to place for cosmetic treatments. So if you'd like to learn more, go to their website, www.contourclinics.com.au. Thank you so much for listening, and we'll see you next time.